Hello, I'm Will Gray, and welcome to Walk the Valley, the podcast that breaks down the barriers bringing healthcare innovation to market. Today, I'm joined by Professor Elizabeth Carlson, Head of Research and Education at the Department of Care Science and the Faculty of Health and Society at Malmö University. Elizabeth has spent much of her career focused on how we educate and support the next generation of healthcare professionals and how new technologies can fit into that work without losing the human connection at its core. In our conversation, we talk about how the pandemic changed both education and care delivery, and the promises and challenges of AI in healthcare, and what decentralised care might mean for the future. Elizabeth also shares her thoughts on how healthcare could evolve over the next 50 years, and why. So, join me for another walk in the valley. Elizabeth, such a pleasure to have you here today. Could you start by introducing yourself to our listeners?
Sure, and first, thank you for inviting me. It was a bit surprising, but also, a really nice thing to be able to do. I'm Elisabeth Carlson. I'm a full-time professor at the Faculty of Health and Society, Department of Care Science. And I've been in academia since the year 2000 really, but my sort of professional background is I'm a registered nurse, and I've been working for 15 years in healthcare, mainly within surgical care, but also within emergency care. So I would like to see myself as an academic nurse, which I think it's good to bring that sort of clinical expertise or clinical experience, at least, into my academic work.
Across healthcare systems worldwide, we're really struggling to attract and retain people. It's stressful, motivation is hard to sustain. How do we begin to encourage more people into healthcare careers today?
Well, the interesting thing is that we saw, and I think that's actually globally, is that during the pandemic, and I'm sure that you're aware of this, when people were banging their casseroles and they were applauding. So we saw an enormous surge, at least for the nursing profession and the medical profession, aligned with the pandemic. And I think that young people actually saw that as a really two interesting careers. I think that we are, in a way, we are challenged because young people also read today about the challenges, and it's stressful, and maybe the career opportunities are slightly limited. So that's really a challenge. But saying that, I think it's also, we can see that when we see the numbers for students that actually applying to both the nursing and the medical professions, which are the two healthcare professions that I'm most familiar with, that we still have high numbers of young people wanting to get a professional career. And I think that is also because it is a professional career, and we do have opportunities to actually land a job. So but there are challenges. It's the pressure is high. The education is stressful. The education actually takes its toll on many students. But we also know that we are lacking, and we're talking about a number of millions and millions of healthcare professions if we just look into the next 5 or 10 years globally. And if I could sort of just for a short moment stay in my own profession, we know that globally we lack roughly 5 million nurses. And compared to Sweden, that would be half of Sweden's current population that really needs to take the step and become registered nurses. So you see, we do have challenges globally. We also know that we have problems with people staying in the profession and on a global level. And I think we need to think globally today when it comes to healthcare professions, is that, well, we might not have a lack of healthcare professions in a specific country, in a specific nation, but the spread of where we actually have the healthcare professions is very unequally distributed. And that's also a problem. And we talk about brain drainage in other professions, but we do have that kind of brain drainage also within the healthcare professions. So, yeah, there are quite a few challenges to overcome. And maybe as a profession, as healthcare professions, we need to be more visible. Even in, when you talk about secondary education, gymnasium, as you say in Swedish, but the upper secondary school, to be present, maybe talk about mentorships or maybe be more innovative and creative. How do we actually enroll people to the healthcare profession, because it is a global problem?
You're right. And the pandemic really forced healthcare to adopt technology faster than ever, from remote care and digital communication to automated testing. What's your thoughts on how that period changed your work and the view of technology in healthcare?
What really happened, is that over a weekend, when I talk to my colleagues, at least in Sweden, over a weekend, between Friday and Monday, we turned around all the syllabuses, all the course descriptions, all the learning activities from campus-based to online. And we had to do that sort of with immediate effect. So I think that sort of, and I think that we actually did succeed. We were unexperienced, but as both teachers and students, we tried. And we tried to sort of accommodate different kinds of learning activities. And how do you do examinations? How can students work within groups? And it sounds as if we hadn't worked digitally before, but not to that extent. So I think that was the sort of, the breaking point, that going from a more campus-based education to a maybe more equally distributed. No, for the pandemic, of course, totally online, and we learned a lot. We also started to use new techniques and new tools and strategies like Padlets and how to use breakout rooms and how to do simulations online and so on. How can we actually work with students synchronous and asynchronous? And what has happened after the pandemic is, of course, that we have gone back to campus-based education for some reasons. But we have also, I think, trying to develop what we can use when it comes to technology. So I think the pandemic maybe, I know that we were heading that way, regardless of the pandemic, but maybe the pandemic gave us sort of, the incentive that we needed.
Healthcare is definitely rightly risk-averse space, but if we think about AI, it has such huge potential, especially potentially in the lower patient contact areas, for example, scheduling or documentation, perhaps, rather than diagnosis, for an extreme example. How do you think healthcare should approach the balance between innovation and safety?
And I think that when it comes to technology, I think we need to learn more. When it comes to AI, for example, I think the sort of AI technology, we need to learn how to sort of handle or to manage. For me, when I look at the healthcare professions, I could easily say, no, we shouldn't use AI at all. We shouldn't use, we use technology all day when it comes to really complex technology tools for sort of keeping the patients alive. But I think that we can also use AI to ease our own professional work. So to me, nursing, the medical profession, all the rehabilitational professionals like occupational therapists and physiotherapists, it's all about relations. So I think that we still need educational-wise campus-based education, and we still need people in the healthcare profession. I think that relation with the patient and the patient's families or next of kin, that's really super important. But on the other hand, if we can use technology and AI to actually give us more time, because that's what we're lacking. And I think that's one of the reasons that people don't stay in the profession. That I'm sort of trained to meet a person in need of my competence, but I don't really have that time because there are so many sort of formal documentation, administration that takes time. And I'm sure that this is something that you're really, really aware of. So if we can use AI in a really smart way, maybe for documentation, maybe like we are doing today, I'm sure that you don't have to transcribe anything. We use that now in research. And I must say, it's sort of surprisingly good how we can use these. I don't really know, all the correct concepts and terms and things, but when we do interviews over telephone or using Teams or Zoom or Google Meets, we have this sort of built-in transcription service instead of transcribing everything yourself by typing. And it's surprisingly good. And I think that if we could use the same technology to give us more time, true time, with our patients. And also I read just the other day of such an example. I think that was a primary healthcare centre, and I'm really sorry, I don't remember where, but somewhere in Sweden, a primary healthcare centre that actually, it's a small study, but they try to use that kind of AI to do the documentation and leave more time for the medical doctors to meet with their patients. I think that is something that we need to look into. I think for education, getting help by AI to create new questions for exams, for assignments, for cases, but we still need to be there as teachers, as well as being there as healthcare professions in the clinical settings. And also, we have more knowledge today, and it's so easily and fast accessible to everyone. And just think about all sort of the Fitbits and the smartwatches and all the applications you can need to monitor your own health, which is good and bad, I think. But some of these applications, like the one that we are working on with ReConnect, sort of guiding, facilitating something, and then you have the educator or you have the healthcare professional, your doctor, your nurse or your OT, to facilitate and guide you and support you. I think that is something that we need to look into more. And I also know that in Sweden, it's a really long country, but we do have really rural areas, maybe not us in Australia, but working on that distance when you don't have hospitals, you might have 300 k's from where you are to the nearest sort of regional hospital. Of course, AI or applications for you as a patient, being able to monitor your own health and then sort of through these distances get some support from the regional hospital, even if you then are sort of 3, 4, 5 hours away. That is maybe not something that we understand in Malmö, where we have sort of, a couple of minutes to two university hospitals, but a large part of Sweden where you don't have any hospitals where you live.
There is a growing interest in the idea of decentralised healthcare, moving cares directly out of hospitals, closer to patients, Is that something that you see happening in practice? How does it show up in your work, and what are the potential upsides of that?
Definitely, and I mean, and it's already happening. It's already happening, and it's called. I'm not sure if you heard it, but it's called nära vård, sort of close care. Or, yeah, so it's already happening that instead of sort of going to the hospital, we want the people to either go to the primary healthcare centres or being cared for at home. And if you are to be cared for back home, you as a patient need quite a lot of knowledge or some kind of support, which could be technology or an application, or as a family member, because if you decentralize the hospital care, you would put more pressure on the families. So the family support, I think, will also become even more important. And you can Google everything, but it's hard if you're sort of not, you need to have a certain amount of knowledge. And if you don't have that, I mean, we can all Google and we will have all kinds of diseases. If you just sort of, I mean, all my symptoms really fits with all these different kinds of diseases, and it's really sort of hard to sort what is really true and what can I do about it and when do I need to call the professionals. But I think with smart technique and maybe with AI or smart applications, we can also help people use the technology, but maybe in a more structured and trustworthy way than quick and dirty searches on Google or any other sort of search engine, of course.
Just like everything in the world today, patients, communities are so much more informed and potentially misinformed as well. We have so much access to information through the internet. How does that affect the way that healthcare professionals have to communicate and interact with their patients to build trust?
Yeah, and that, I think that's sort of it's good. It's good that people are informed. They can also maybe ask more informed questions. You can actually sort of direct and meet that specific patient's need. But it's so much out there, so you also need guidance. So how can I sort through, how can I sort of sift through all that information and make sure that the information I'm going to use as a patient or as that family member is trustworthy and correct. And maybe there are that kind of technology, I'm not really sure, but I think that's where technology can help us.
Big news in the tech space. We're seeing Daniel Ek and a group of other investors and individuals launching Neko Health, offering proactive health scans directly to consumers. Very interesting model, but some concerns about the way that it commercializes healthcare. How do you view that kind of patient-driven technology?
Well, I read about him as well, and I'm not really sure that I'm sort of, that well informed about what he wants to do. But we have seen sort of kind of the same ideas before. And the problem is that do I, as an individual, really know what kind of tests I need to take? And if someone offers you a smorgasbord that, we have all these tests, I think that a majority of people would like to say, sure, that's amazing. Please give it to me. But then it's even more important that first that you actually have a healthcare professional. I mean, you need to, I'm not sure, maybe he has that system in place with proper sort of healthcare professionals, but you really need some kind of guidance as well. So I'm not sort of opposed to people taking more responsible for their own care, and specifically in a preventive matter, that is fine. But I think that we still need to think, and I'm always thinking about that relational aspect and that relationship that you create with a patient in need of your expertise and in need of your advice. So yes, he might fill a blank spot, a void in the market, because I think this is sort of a market thing. I mean, hey, he created and invented Spotify, so it's hard to say no, this is sort of, this is just philanthropic. I don't think so. But I still think that we should use technology wisely. We still need, hopefully we still need a sort of critical, experienced person that can then also guide you. So we shouldn't say no, and I don't think that we should be afraid. We just need to know how can we use, both as professionals, but also as individuals or member of the communities, how can we use, because now it's also so, it's novelty, and everyone tries. It's so fun to try ChatGPT, and you can find all the answers you want to find, and it's fun. It is fun, but I think we still need, I hope, that sort of professional experience to guide us.
We spend a lot of time in Walk the Valley talking about regulation, especially when we focus on medtech. And founders in Europe overall just say that how medtech has been so over-regulated. It's strangling the innovation and it's strangling the progress of the industry. From the healthcare side, what's your perspective on that? Do you feel that as well? How does regulation shape or restrict what you do in your work?
Yeah, sure. I mean, we do have loads of regulations, and it all sort of boils down to patient safety. So talking about the educational part, if we could sort of just split it into two, we are of course regulated because all the healthcare professions, not maybe all, because depends on where you sort of draw the line, but yeah, for nurses and doctors and PTs and that sort of kind of quite long academic educations, we are also registered and licensed. And with that license or that sort of register comes also obligations. So that is really regulated. So it's very sort of formalized what is expected of me when I go out and start to practice. And I can also lose that license to practice, of course. So that is regulated. And it is also regulated when it comes how to organize the healthcare systems, of course. And also which medical equipment can we buy in, what kind of pharmaceutical drugs can we use, what are the golden standards for treating this kind of illnesses or diseases, or this category of patients. So yes, we also have loads of regulations and sort of formal documents that guide our practices, and I think that is really, really necessary. Otherwise it will be the Wild West. We talked early this morning about a new research project about professional governance. So, of course, you need an organized, maybe a financial governance of a healthcare system. But what I think is lacking today is the professional governance, meaning that the professions know what's my mandate. What can I actually govern? What can I decide within my professional expertise? And is that allowed in the system, in the organizations? So that's also a form of regulations or that we need to sort of understand that how can that be done? So yeah, loads of regulations and hierarchies. I think that healthcare might be one of the last man standing when it comes to hierarchies.
Last question, Elisabeth. Looking half a century into the future, what does healthcare look like? Is it highly technological, or Is it struggling to maintain its human-centered focus, or is it something entirely different that we couldn't imagine today?
Maybe. And we've seen this already, that I think we're going to use robots more, not only for surgery, but we have also seen sort of research, or at least sort of, innovations that try robotic dogs or robots to assist in elderly people's home, for example. And I think that might be a super idea. I think that we will have even more advanced technology to actually treat the patients. We talk about precision health, what will happen with sort of precision medicine, where we can actually be very, very precise what you as an individual need. That will also probably lead to that we need more technology. So I don't think that we should be afraid. It will look very different, but maybe I still would like to see that the core is still the relationship between patients, families, and healthcare professions. But I don't think that we can say no or turn around that clock. I mean, we're already there. We just need to be smart and see how can we actually combine and work in parallel with all the sort of new technological innovations that we will see. And I'm sure that not even you can see where does that end. But I would like to be positive and see that we still have a very strong relationship with actual healthcare professionals.
That is a wrap for this episode of Walk the Valley. Talking with Elisabeth gave us a thoughtful look on how healthcare is evolving. From the digital acceleration sparked by the pandemic to the complex role of AI technology in patient care. My big takeaway: even as healthcare becomes more connected and data-driven, its foundation remains deeply human. Technology should give professionals more time for what matters most, the relationship between caregiver and the patient. If you found this episode insightful, don't forget to subscribe and leave a review. It helps us bring more real-world lessons to innovators like yourselves. And remember, you can now listen to Walk the Valley on Apple Podcasts and Spotify. Thanks for tuning in, and until next time, keep walking the valley.